As we talked about, healthcare is on the ballot this election season. Coming up, find out what LA public health officials are saying about Medicare for all after the break. All right, welcome back. We have more in-depth coverage on healthcare. So if you're voting in the Democratic primary on March 3rd, you essentially have to choose between two ideas. Senators Bernie Sanders and Elizabeth Warren are calling for a single-payer system. You might know it as Medicare for all. In contrast, Vice President Joe Biden, Mayor Pete Buttigieg, and Senator Amy Klobuchar, they all support adding a public option that would compete with the private industry. That's actually what we already have right here in Los Angeles. If you qualify for Medicaid, your insurance is covered through a nonprofit called LA Care. You can also get LA Care on California's healthcare exchange. I sat down with their CEO to talk about what you should know before you vote. And joining me now is John Baackes, the CEO of LA Care. Thank you so much for coming on the program.
My pleasure.
So I think when people watch the piece, at least on paper, this program makes sense, right? And it makes sense to a lot of people. It's incredibly expensive to take care of someone medically if they're living on the street or in a shelter. What are some of the barriers to expanding a program like this?
Permanent supportive housing. We do not have enough housing units designated for people who are homeless that we can afford to move them into. So that's probably the largest issue facing us in Los Angeles County, is there just not enough affordable places. Many of the folks who count as homeless, and some of them are our members, are people who just can't pay the rent and they move into their car. We have 16,000 people in Los Angeles County living in their cars. And don't have a permanent place to live.
I learned so much working on the story, but I think one of the most astounding things to me was an apartment in Palmdale is still $1,200 a month, which is more than, you know, this guy's Social Security benefits can cover.
Exactly. So it is a real issue. It's exacerbated in California by the high cost of housing here and the high cost of land. But it's probably the heart of the issue of how are we going to reduce the number of people on the streets, because even those who want to get off the streets, we just don't have enough places to put them. So we need to increase the supply of housing that's affordable and also below affordable, where we can move people who are homeless.
All right, I want to pivot a little bit and now talk about the presidential election. Californians who are voting in the March 3rd primary, one of the main issues that they're looking at is healthcare, and basically two competing ideas, right? A public option or blowing up the whole system and doing single payer. Let's start with a public option, because LA essentially has a public option. It's LA Care. So how is that playing out in this insurance marketplace?
There are 6 plans available here in Los Angeles County to people who come to the exchange. It's LA Care and 5 commercial plans, all well-known plans. What happened is then we got around to 2020, our competitors lowered their prices, which people go, oh, isn't that horrible? I said, no, that's exactly what was supposed to happen. A public option with lower margins is competing against the commercial plans. They're sharpening their pencils and innovating and figure out ways to beat us. We're going to sharpen our pencils and innovate so that next year we can again offer an even cheaper version of today's plan. And I think that's the point of the public option. It's competition. And with competition, you have innovation, new ideas on how to do things.
In your view, a public option like we have here in LA, is this something that could work in other places in America?
Absolutely. There's no reason it can't work. And the thing that people need to remember, in the public option, the way it's been executed here, we compete on the same terms as the commercial plans.
Any other advice you would give to voters who are trying to decide and looking at the different proposals from different candidates?
Well, I think people have to look at it, and I think most people do look at it through the lens of their own experience. Like, what are my needs? What do I have? Do I like it? Is it serving what I need? Could it be better?
All right, well, thank you so much for coming on, John, and explaining an extremely, extremely complicated topic in such a simple way. So I appreciate it. Thank you.
My pleasure. Thank you.
Thank you. So John told me he just got back from Washington, D.C., where he briefed House Democrats on what LA Care is doing. And he reminded them that the House passed a public option 10 years ago as part of the Affordable Care Act, but it died in the Senate.